Hi guys, it's Sarah Becker here, Director of Marketing at VirtualHealth, and we're jumping in for another special feature care chat around our continued discussion around FHIR. I've got Huthaifa Khan, Director of Solutions Architecture here at VirtualHealth, and we've got a special guest direct from HL7, Daniel Bach, Community Manager.
Hi, my name is Daniel. I serve as HL7's community manager. I started at HL7 October 2023. I'm really excited about the great work that VirtualHealth and other FHIR vendors are doing in the market. So very glad to be here today.
Hey everyone, Huthaifa Khan, Director for Solutions Architecture here at VirtualHealth. If you've seen any of the previous Future of Care chats, some of you may recognize me. My main focus here at VirtualHealth is really around interoperability, which FHIR is playing a very, very big part in as of recently.
Thanks, you guys. And as I mentioned, we've got more future care chats. So if you've heard us talk about FHIR, the importance of interoperability, the new regulations that are happening around CMS with our recent episode with Michael Linda from Fertility Health, feel free to tune in. We'll drop those links at the end of this chat. But for today's topic, we invited Daniel to come join us because we specifically want to look at how FHIR interoperability enhances patient engagement and impacts outcomes. So I'm going to turn it over to these guys who are the experts in this field and kick things.
So I definitely think this is a very key topic. One, I feel because health interoperability is still sort of in its kind of early phases. So for example, it wasn't much longer than 10 years ago where EHRs weren't implemented in the majority of U.S. hospitals. So we saw with, for example, various ONC rulings such as meaningful use 1, 2, EHR adoption has really sped up. And now with the advent of FHIR, and FHIR really only being about 10 years old as a standard, is starting to see widespread adoption. So we're seeing a lot of exciting developments within the healthcare field with regard to patient engagement and interoperability. So for example, patients being able to access their health data, but also being able to actually construct longitudinal records, being able to piece together various data from various different sources. And if you're someone who suffers from a chronic condition, or perhaps you have been receiving care over many different providers and different kind of episodes in your life, you may need to have that data all in one consolidated place, or have easy access to that data in order to short feature providers and take a much more involved approach to your own care. So we've seen that helps patient outcomes as well.
And from a FHIR perspective, I think it's important to note that there have been multiple efforts in the past with regards to interoperability within healthcare. So we've seen things like HL7 from an insurance or a health plan perspective. We've seen X12, which I genuinely have a dislike for as far as interoperability goes. Not for any other reason other than that the standards that were being used, while they made sense from a healthcare specific domain perspective, they didn't really allow a ease of transfer because you had to have very, very specialized technology with which to operate with. And HL7 and X12 are two very, very good examples of that. And FHIR, one of the big things for me as far as driving that patient engagement and then ultimately patient outcomes is the ease with which different technology vendors can process that particular information. So like Daniel spoke about before, it was only relatively recently from a technology perspective that hospitals, clinics started adopting EMRs. Now, prior to that, if you wanted your health information to be available to the next specialist that you were at, or a number of specialists that you now have to see for whatever multifaceted problem that you had, it was quite a big lift and quite a manual lift to have to do all of those things individually. And I've spoken about this before, but FHIR isn't just a data structure. It deals with the framework and the technology integration around it, which makes it easy for everyone to get involved. It's open source, it's available. So realistically speaking, if everyone's dealing with that, then everyone can transfer that information. And I think having that information available, not just to be able to send to different providers, but to the patient themselves, I think is super important. We've seen a large uptick in vendors taking efforts to allow for patients to access their data insofar as they have it on their records. And so having FHIR allows them to ingest other data that may be coming from external sources to increase the breadth of what Daniel mentioned before, that longitudinal patient record.
Yeah, I just want to kind of touch upon one of Khan's points with regards to past attempts to achieve healthcare interoperability. So obviously there have been past attempts, but I feel now there's a confluence of factors that makes FHIR so special. So for example, one, as Khan mentioned, it does leverage modern web protocols. It does leverage modern technology that other industries are using. But I feel also the nature of healthcare interoperability is that because there are so many variables, so for example, the financial industry has achieved a modicum of interoperability for a while now, but for health interoperability, you're dealing with multiple factors, you're dealing with multiple variables and multiple values. And one of the interesting things about the FHIR standard is that because of its open standard nature, you have a lot of individuals and organizations contributing to the growth of that standard. So for example, with the initial versions of the FHIR standard, you had DSTU1, DSTU2, and it still started going towards a normative standard, which it achieved with R4. And now we see with R5 and R6, you see many more organizations are their expertise and their voices to that standard itself. And on the topic of patient engagement as well, the HL7 International Organization is also very keen to get that patient voice in. For example, we have many working groups, and one of the working groups we actually have is something called the Patient Empowerment Working Group to take into account the perspective of the patient with regards to the data they'll be receiving. For example, what data does the patient need in order to resolve a certain health situation? What data, how should FHIR resources be structured in order for the patient to be benefited the most?
A really good example that I can give where patient engagement really matters is, as of recently, like many millennials, I've kind of put my health on the back burner as we've been driving through our careers, and also the general healthcare systems across the world at the moment have seen a relative decline in their efficiencies. And so for many of us, a lot of us have a lot of anxiety and a lot of concern about going to the doctors, not just because of the steps that have to be taken to do it, but also being a little bit scared of the outcomes that come from it. You get a call from your doctor, hey, can you come do a catch up? And you don't really know what to expect or kind of what you're looking for. But one example that I had, and this is with Ontario Healthcare, I had some blood tests done, and my Care Compass handles a lot of that stuff. So I was able to sign up to review my test results prior to going into the doctor for my follow-up. And it gave me indications of like, hey, this might be, edging towards a risk factor of some kind. This is all good. This is looking fine. This was this because you were fasting or not fasting, that kind of thing. And for me, that personally made quite a big difference, because it meant that I wasn't going into my next appointment completely blind about what to expect. But it also empowered me a little bit to kind of start taking a look at my own health without having to get in front of a doctor to do it, and say, what steps can I take to really help mitigate or address some of the issues that I may be seeing in this particular outcome or in this particular set of results. I think that that's a really important aspect of it, especially as generations get older. We have a lot of technology. We're so used to using tech to do everything. We have Uber Eats. We can get things delivered to our door that I think 2 generations ago people would think we were crazy about. I don't see any reason that it should not be the same for healthcare and our ability to plan for it, to view what we have done and what we need to do. And I think FHIR really takes us a step further in that particular direction, in the sense that, like Daniel spoke about before, there have been efforts towards interoperability, but they've been very, very healthcare specific. FHIR is a standard that uses kind of agnostic technology underneath it. It doesn't have to have a specific healthcare approach to it. And so it opens the door for a lot of other vendors to get involved, because they don't feel so gated by what's going on in this particular process. And I think it speaks to why we have adopted FHIR as kind of our approach from a virtual health perspective. While our Helios platform does have its own proprietary data structure underneath it with which to operate a lot of the care and utilization management pieces that we have, we've adopted FHIR via our Helios Hub product, which now allows us to talk with a multitude of other systems that are also FHIR compliant. Helios Hub does work with things outside of FHIR, but its core process really is surrounded by it and enabling that. And so we now have systems that are incorporated with 3 or 4 different external source systems that then feed that longitudinal patient record. So we can now see their medical history, we can see their upcoming episodes or their schedules. From an authorization perspective, we can receive requested authorizations from providers directly so that care managers and utilization managers don't have to go, digging into multiple different systems in order to check, hey, what exactly do we need to get this patient scheduled for or serviced for in order to address risk scores and other things like that. So yeah, just a little bit of a personal and professional insight into how I think that driving that patient engagement from a FHIR perspective has helped and will help a lot more in the future.
You guys bring up an interesting point too, right? Thinking through the immediate and long-term value of FHIR. And I think you both touched on it, and I want to kind of ask a question back. Some of these payer groups right now, right, with the CMS regulations that come out in January, I think, I can wait because they've already done some FHIR, right? They've already had some FHIR APIs they've had to implement in the past, but there are others now. And then you're hearing from data coming out of Backers and Gartner, they're like, oh, I can wait a little bit. It's not a rush. I've got time. But from what you guys are saying, there's value in making sure they're on the FHIR standard now. And it's not just something that is related to compliance regulations. It's really going to actually enable them to take another step forward to optimize not only a longitudinal care model approach, but predictive healthcare to empower patients, to educate patients, to improve health outcomes in the immediate sense, right? So it's beyond compliance right now. It's going to actually help them improve their overall program and the health of their member base, if I'm hearing this right.
I can agree 100% on that particular point. And a lot of it does come down to that value that FHIR adds from a interoperability perspective. One of the big things from a compliance perspective, but ties in very, very well to what we're talking about and what you just mentioned, is the patient access API that's come through from CMS, which is a FHIR-based process in which a patient can access all of the information that a health plan has on them. Now, we need to look at a lot of these things, and I really appreciate the way that CMS have done this, but also the way that they have approached it using FHIR so that it's an incremental process for the payers because it's using one standard across the board, right? When we saw things like meaningful use come in from ONC, the concept of it was great, but the data needed or the data structures used for like multiple areas of that were different. They weren't standardized. They weren't approached in the same way. And so if you were dealing with different organizations trying to meet that need, right, there wasn't really a straightforward path with which to do it. With FHIR, however, there is. So CMS started off by introducing the patient access and provider directory APIs, which was all FHIR-based. So that was just the first bit. It was saying to payers, hey, give us or allow patients to access the information that you have on hand and have that available in FHIR, because then that allows them and other applications to surface that data, and you don't really have to do it yourself if you can partner with someone who already has that. And then the provider directory API, which I think was an amazing piece of work from CMS to drive patient engagement. By being able to look at your providers and what's available to your network for your plan prior to asking for a referral or prior to going through with an appointment for them, you're able to not just save yourself like time and money, but also overhead costs as well as money from a payer perspective, because you're going to be going to someone in network if you can. But then they also built on top of that with the payer-to-payer API, where now all of the information that you have, if your patient requests it, which again empowers the patient and the member to really drive this if they want to then transfer that over another payer that they are now transferring to. At that point, because the patient access API was done first and payers have assumed to adopted FHIR at that point, and we're using that exact same standard in the payer-to-payer API, it's very, very, I mean, I won't say smooth. I've done some payer-to-payer implementations and it's never smooth when you're dealing at that scale, but it's a lot less problematic and it's a lot less opaque than it has been in the past, because you're already working with a standard that you know. And then we have the prior authorization API as well, which allows providers and members also to work through some of that stuff in order to be able to transfer all of that information. So we are now talking about a sum total of 4 different aspects of healthcare and how patients are engaged with their own healthcare from this perspective. And all of it uses FHIR. Right? No one's having to change technologies or go through training on a completely new data format. It's all the same as it goes through. And I think one of the great things about having people like Daniel involved in this is that patient engagement and that patient empowerment that we're driving towards, because that's really going to help us move forward and make that more and more available to everyone, and not just regionally as well. My real end goal is to be able to handle this kind of stuff internationally too. I moved from New Zealand to the US and then over to Canada. I have a storied history past, which I've mentioned before, with regards to my IBS, my ADHD. I had Helicobacter pylori at one point. Being able to transfer that information from doctor to doctor, even across borders, which FHIR is completely capable of doing. I just not think it's not something that we've really looked at first, because we're trying to make sure we figure it out, within each jurisdiction initially. But that kind of long-term goal, I think, is possible with FHIR. And I think ultimately, from a patient engagement perspective, it'll help providers too, because I don't think providers nor payers really want to go through the hassle of trying to do all of that stuff manually. And ultimately, better health outcomes leads to better happiness for the patients themselves, less work for the providers and less confusion for the providers. And then also for the people who are handling the financials, it means less burn for them as well.
Definitely. And I'd also like to add one, the FHIR standard is best poised to help these interoperability initiatives because there are mechanisms within FHIR that facilitate interoperability. So for example, with past health data standards, there might have been an nth degree of customization, but with FHIR, you have baked in implementations, you have common data structure, CDI, that all these organizations can adhere to. And so if you have a FHIR portfolio, you can have it on a regional level as well and a municipal level. So this allows for some customization with regards to extensions for certain use cases, but ensures that everyone's using the same data structure, everyone's using the same implementation guide. FHIR is an open standard and the community is contributing to the development of the standard. You're able to really understand exactly what's working, what's not, what do we need to improve on the next iteration, what do we need to perhaps, what do we need to perhaps with regards to the next release of FHIR. And it's just process that's really self-governing in a sense, because it is that open standard. You have the best practices and the community contributing their expertise. Whereas with past healthcare data standards, there definitely was a community process, but not as variegated and diverse as the one we see with FHIR. Now, the standard is continuing to grow, and as healthcare continues to evolve, the standard continues to evolve with it.
One more thing that I'll add.
Putting things on hold is, they're waiting. What would you guys say to that?
I would say get onto it immediately. Not just because there are compliance deadlines coming up, also because being ahead of that is not only going to allow you to kind of settle yourself early when it comes to those compliance deadlines and changes that are likely to come immediately after their implementation, but I think also it allows organizations to really be adaptable in a technology environment. If there's a new vendor that's coming out with a piece of software that could be really beneficial to you, but historically has been out of reach because of the integration requirements or the interoperability requirements to use it, now, if they are FHIR compliant, which every vendor, I think, from a healthcare perspective should be working towards, it becomes a lot easier because now you're like, okay, cool. What resources do you need? I need the patient resource. I need the observations, depending on what exactly it is they're doing, the encounters, conditions, allergy intolerances, or do you need things like the claims, the explanation of benefits? Do you need coverage and your eligibility, right? All that kind of stuff. It's very easy to all be speaking the same language rather than starting to talk about, the meaningful use guide has these data elements and how are you going to send us these data elements? It's like, no, which resources do you want? And you can pass it over. And one other thing that I was going to add just before is, in terms of patient engagement, Smart on FHIR, which is really the authentication and to an extent the consent protocol that's used within the FHIR standard, it's another thing that becomes a lot easier and a lot smoother for organizations, because prior to FHIR, the idea of providing consent, providing that information and being able to track it in a way that auditing wise your organization feels safe in what they've executed, FHIR covers that too. So if the organizational vendor that you're integrating with has Smart on FHIR, It's as simple as connecting, a single sign-on protocol, which is something that technology industries across the world do on a daily basis. And it's a hell of a lot easier because they follow a standard. And FHIR is very, very similar in that regard too.
Definitely. Just to echo Khan in regards to kind of getting on that immediately. I was recently at the Dev Days in Minneapolis. And so it's an event that's kind of co-hosted by HL7 International. And one of our keynote speakers, he spoke about something called Amara's Law. And so effectively, Amara's Law states you overestimate a technology in the short term and underestimate it in the long term. And the speaker was getting at the fact that many people think that FHIR is simply just something on a compliance checklist. But now we're starting to see the advances FHIR is making in areas hitherto people didn't think were possible. So for example, work done with the CDC with regards to public health or, patient engagement, as Khan mentioned. So we had a lot of individuals from various US hospitals in the Northeast, and they were speaking about how they're using Smart on FHIR to connect to their EHRs. And so patients have a choice with regards to the apps they can actually get their health data. So for example, certain health conditions, you might need to take multiple blood tests, you might need to take multiple x-rays. So we have FHIR resources with regards to observation and diagnostic reports. So patients, as Khan mentioned before, we live in a world now where people expect choice and ease of access to use. And there's nothing really more pertinent than your health data. And I think it's something that touches a lot of people because you're going to be a patient yourself or you have a loved one or family member who is a patient themselves. So for example, my son, he has a condition called benign neutropenia. And so effectively, long story short, he lacks a certain type of white blood cell. So he has to go get blood draws pretty regularly just to kind of monitor everything. And my local hospital, Sick Kids in Toronto, they have a patient portal where parents can log in and they can actually track the progress over time. But it's actually much more helpful than that because when God forbid, he goes on vacation, he, experiences symptoms, I can go to a local hospital and I can have it on my phone and say, hey, this is what the doctor has recommended in an ER room that might not be equipped. And so you might get doctors who are not aware of his condition, but once they see the notes that his home doctor has actually put on his patient portal, they know exactly what the protocol would be. That's sort of an extreme case with regards to interoperability. But even in my case, as I'm getting into my late 30s, you're going to the doctor more often and you want to be able to keep on track of your health data so you can make more informed decisions. But also you're not going to your doctor over small things. You understand, you're informed, and you're making better decisions with regards to your health.
It really is time. It's time to get on FHIR and to be leveraging the incredible value that FHIR can offer. And I love hearing to Daniel all the things that are in the works with HL7 and the fact that that next phase is really going to bring patients more involved. And I think even from a health plan perspective, that's incredibly valuable because that actually takes away all the extra effort they need to make to engage patients and educate them to ensure they're informed properly. And I think both the examples you guys have provided on a personal level are exactly why, right, we need to be moving on this and continuing discussions on taking it to the next level. So thank you both for having this discussion today and joining us. And for those of you who would like more information around FHIR, as well as the work that we're doing related to FHIR and virtual health, we'll be providing those resources after this video. Thank you guys for joining us for our future catch-up.